Let's talk about rTMS, or repetitive transcranial magnetic stimulation. Hello, I'm Dr. Sam, this is Dr. Sam's Health, and today I would like to make a bit of an unusual video because it will be a video about one very specific psychiatric procedure that we use usually in treatment-resistant depression. The procedure is called rTMS, or repetitive transcranial magnetic stimulation. Beautifully designed procedure. I happen to be an expert in this field, and I delivered this procedure to quite a few people in my life in the last several years. And a month and a half ago, I've been to a conference in Madrid, and I was making a poster presentation there. And by that, I mean that I prepared a poster, which is like pretty much a quick report of the outcomes of rTMS at the place where I worked then. And I didn't even realize, but they expected me to give a talk. So I happened to be in the area where it meant to be happen, and I had a friend of mine who was going to, I don't know, take a picture of me next to my poster, but it turned out that I was supposed to give a talk. So I gave a talk. It was very expromptu kind of talk. But now I've got a video footage of that, and I would like to share it with you, just because I don't want it to be wasted. And in general, it's something that I feel would be amazing thing to share with general public or with my YouTube subscribers. So now we're going to watch this video, but before we go ahead with that, I would like to remind you that I'm a psychiatrist. As you could see in the video, I do not provide any kind of medical advice over YouTube or internet in general. So this video is just purely for educational purposes and doesn't necessarily reflect the opinions or statements that would be made by my college, my regulatory bodies, by my university, by my profession in general psychiatry, and so on. Though it is a nice piece of clinical research that I'm happy to share with you. And now we can go ahead and watch it. Let's go. Thank you so much. So I must confess, I was not planning to present today. I totally forgot about it, but luckily we figured out that it's time. So, until recently I worked in this place, Homewood Health Center. We had an amazing opportunity to use our TMS machine for all the patients who are coming in. The data here are for approximately 100 patients that we have treated over the course of several years. Right now we've got a little bit more data, like 155. But the key point is that it's an inpatient treatment facility where the patients are in a controlled environment. They stay on a variety of units. Most of the patients came from comprehensive psychiatric care unit and mood and anxiety disorders unit. Almost all of them have depression, and the vast majority of them have at least one or two comorbidities. We're talking about personality disorders. 70-80% of them have a variety of anxiety disorders, some somatic symptom disorders, PTSD. Some patients have addictions, and so on. So that's why we're talking about transdiagnostic effectiveness, because rTMS is approved in Canada at least for essentially for treatment of depression. And we were using it for depression, but we also observed a lot of improvement in anxiety symptoms, and that's essentially what I'm presenting here, because that is a nice side effect, because most of the patients with depression, they have anxiety symptoms, and we can see that over the course of the treatment, which was 46 weeks, usually 20 to 30 sessions, it brings significant decrease on average in terms of severity of depressive symptoms, and also almost similar decrease in terms of anxiety symptoms. So vast majority of patients actually tolerating the procedure really, really well. A lot of people are afraid of seizures, which are actually quite rare. A lot of patients experience very interesting side effects. Like, for example, we had an elderly patient who suddenly, after 2 treatments with rTMS, suddenly her vision improved. And that was like the most ridiculous thing. You would think it's like some sort of a neurological symptom disorder, and we actually checked. So she was a person with presbyopia who literally had to wear glasses. And after 2 sessions, suddenly she said, like, I cannot see well with glasses, took them off. And somehow it hilariously improved her vision. I still don't believe that there must be some sort of psychiatric reasons for that, but overall we had very good results. Only few patients dropped out. We had some patients who were not able to finish just because of like financial restraints, or they had to leave the hospital. But interestingly enough, a lot of patients wanted continuation, and it's not included here, but what I wanted to say is that if you have patients in your practice who undergo an rTMS, our data actually show that extending the treatment past 20-30 sessions usually doesn't lead to any significant reports. It creates good rapport, patients love it, and they have a feeling that they're receiving more substantial comprehensive treatment. But at the same time, we know for sure that the data is like no significant improvement. Overall, very feasible, easily tolerated. Most common side effect is some sort of headache, a variety of those, and patients love it. It's very different from anything else that we use. It's non-invasive. We have patients coming over actually. Sometimes we like literally drive their car, arrive to the unit, receive a procedure that lasts like 4 minutes, 3 minutes, 19 seconds, and just drive back home. So quite effective, very different, and very feasible. And that would be it. I see that there is a question. No? I thought you were raising a big. No? Okay. Are there any questions?
How often do they receive the treatment?
So our protocol, which is very standard. So, if you don't mind, there are 3 major types of rTMS. One is the original one, high frequency, which is usually delivered to the left dorsolateral prefrontal cortex. That one lasts approximately 45-46 minutes. We have high frequency impulses. There's low frequency protocol where it's supposed to be inhibitory. And the third one is a theta burst, where there is a very complex cadence of impulses that are delivered, but they last like 3 minutes and 90 seconds. Very effective, and there are multiple of studies actually done in Canada that show that it's as effective as high frequency. Treatments are usually done once a day over the course of 20 to 30 days. So essentially 4-6 weeks. There is also deep rTMS, which is very different. The idea is that with this procedure, we have coils attached to a person's head. The depth of the focus length of this coil is only like a couple of centimeters, so we can only address the cortical areas. Deep rTMS is essentially the person's head is inside the magnet, and we can address or affect deeply placed structures. And there is also, I think it's called Stanford protocol, when they try to do this kind of treatments, but instead of once a day, they do 10 of them in 1 day. I find it to be actually very hard to tolerate for some patients, and we couldn't do it just because we had multiple patients receiving treatment with the same machine. But I think I did more than answer.
Exactly. Thank you.
Yeah. Did you also use booster sessions?
That is actually a good question. So we have some patients who want to have booster sessions after they have completed the course. We provided that. I'm not sure if we can. Well, the data are not related to that. There's no good protocol for booster sessions. What I've done was.
Would you recommend?
I actually don't. I recommend that if the person needs a booster session, it's better to do a full course, repeat 4-6 weeks.
Thanks.
Very much. One question. The Stanford protocol, even if you wanted to do it, you can't do it because it's secret. You know, they're using it for to sell it. You know, it's quite a different protocol which nobody knows it except them. But my question is, if you have patients with a long distance, would you offer them treatments more than once per day with theta burst, which is tolerated very well?
So this is an amazing question because we actually, it's a very practical limitation of what we could do. That's why I mentioned the Stanford protocol, because it works with somebody comes for a week, and over the course of 1 week, they receive multiple treatments. There were actually studies when they trying to see what is the optimal frequency, and it showed they pretty much showed that unless you're doing at least 5-6 treatments a day, it's not there's no benefit. So we couldn't offer it, but the answer is sometimes theoretically you can have somebody coming over, staying in a hotel next door, and receiving treatment over the course of 10 days or so.
It's the case, for example, in Australia, where people have to travel thousands of kilometers.
Yeah.
Okay, any questions? Yeah.
You invite patients to targeting the same zones and everything.
So this is I've got we use the same zone,
but that is based on a number of meta-analysis that is out there, a number of studies actually, when they tried different protocols and using left and right dorsal and frontal cortices, plus minus different intensities, different everything, and the bottom line result is it doesn't really matter what you do, as long as you're doing left DLBFC. Theta burst works exactly the same as all the other modalities. Given that we are using it primarily for depression, we chose to stick to the thing that definitely helps depression. So we had a couple of cases when we used it in different areas, but just because some people could not tolerate it.
Which type you have used? High frequency or
We used Theta burst, which is a modified high frequency. I cannot even describe it. There's like literally 3 very quick pulses at certain cadence, and there is a certain frequency of these pulses. Yeah. But that was the name of the business.
Okay, thank you very much.
Thank you.
And that was it. Thank you for watching this video clip. It was very small, but in my opinion, quite an important communication. I hope you got the whole message, which is there is a procedure called rTMS. This procedure is quite helpful, especially in cases when people have tried multiple medications and nothing really worked or helped. We can try that. It also helps with anxiety symptoms. It's usually well tolerated. We only had a couple of people who dropped out of treatment because of side effects. And that's pretty much everything I wanted to share with you. It was a little bit of my real life work, real life scientific communication. And I hope you enjoy this kind of content. Please go ahead and ask questions, leave comments, hit the like button, subscribe, check out my website, drsamshealth.com, and I'll see you there in my future videos. Thank you so much. Have a wonderful everything.